I'm on the line with a prominent private practice owner, physical therapist in California, and I have a couple quick questions. First of all, thanks for joining us today.
Absolutely.
So I understand that you recently had a situation with an orthopedic surgeon with respect to him wanting you to come in and run his physician-owned physical therapy practice and more, it sounds like. Could you elaborate on that conversation you had?
Sure, absolutely. That's correct. About a few years back, the largest orthopedic surgery group practice here in our area decided that they were going to put everything under one roof and have their own rehab center attached to their, group of surgeons. The chief of the group called me one day out of the blue and asked me to lunch, and I thought, oh wow, great, he's going to, take me out to lunch and tell us what a great job we're doing for his patients. Well, much to my surprise, he essentially indicated his intentions to open his own private practice physical therapy group there in his office, and strongly suggested that I consider coming to work for he and his partners, and that if I didn't, that things were going to be bad for me and probably for all of the other physical therapists in this area, because they were such a large group with such a stronghold on steering referrals. Of course, I was very hot under the collar, but I respectfully declined and indicated to him that I'd worked too hard and too long to establish my own practice, my own reputation, and that I wasn't interested. And his response to that was, we're only looking for about $50,000 annually per partner to generate through this physical therapy entity that we're going to own. And at that point, I explained that he obviously didn't understand that most physical therapists worth their salt are not interested in working for orthopedic surgeons, and if they're true to their profession, then they stand on their own 2 feet and they work for themselves. And of course, the lunch didn't go so well after that, but nonetheless, it was pretty shocking. And I'm happy and proud to say that we weathered that storm and are in fact still here, and are seeing quite a few patients from their office simply because they want to be here.
I think he not only expressed his intentions to have his own rehab practice, but it was the general behavior that we see with other types of services. Perhaps he was interested in owning his own MRI. Can you just elaborate on that?
Sure. One of the things that I think incensed me the most about this particular group was that they actually called my clinic during normal business hours, and this happened on 2 occasions that I have on record because my staff therapists, who are loyal, came to me and told me about this, but they actually called my practice during the day to ask to speak to my therapists working here in our office, which is physical therapist owned, and actively tried to recruit my therapists while they were working during normal business hours to come over and work for them. And one I can quote as saying is, I know that you're, a good physical therapist. The patients say so, but, we can pay you more than your boss can, and why don't you come on over here and check out our shop? And of course, the therapist, came to me personally immediately following those phone calls, very upset and very disgraced by the physician's behavior. But certainly they're just trying to essentially corral everything around themselves. They want their own lab, they want their own MRI, they want their own surgery center, and now they want to own another profession that they should not have anything to do with. So yes, that's been the run of things with that group.
Well, thank you for that input. That's certainly consistent with what we read in the literature and what we hear on an almost daily basis in our investigation of these physician-owned physical therapy practices. And it's just a real story from a real physical therapy practice owner. It has to be told because Californians and consumers cannot afford to allow these referral-for-profit kickbacks that Mary Hayashi has introduced in her Bill 783